Good morning everyone. This is Dr. Pushpa, Assistant Professor in Physiotherapy Department of RPIIT Campus, Karnal. So today topic is claw hand. What is the claw hand? It is a condition in which the finger are curved or bent. This condition can affect one or more of the finger on one or both hand. Ulnar innervate the flexor carpi ulnaris and the flexor digitorum profundus after it passes through the cubital tunnel. Cubital tunnel is the opening between the two heads of the muscles through which the ulnar passes at the elbow and enter the forearm. Alnanar palsy is the loss of sensory and motor function. This can occur after the injury to any portion of the ulnar. The ulnar is the terminal branch of medial cord, that is C8 and the T1. Now causes or etiology of the claw hand. First is nerve damage in the arm region. For example, ulnar palsy, medial nerve palsy, ulnar tunnel syndrome and the cubital tunnel syndrome. And next is the congenital birth defect. Congenital birth defect is also known as the congenital disorder, is a condition present at the birth. Regardless of its causes, birth defect may result in the disability, may be intellectual, developmental or the physical. And any other causes, genetic disease such as Charcot disease and bacterial infection such as leprosy and the severe hand burn. Now types, claw hand deformity can be two types. First is complete claw hand and second is the incomplete or partial hand. In the complete, it involves all the digits and that result both ulnar and median nerve palsy. And in incomplete or partial claw hand, it involves only ring finger and the little finger, that is ulnar nerve palsy. You can see here, this is the claw hand deformity. MCP joint is the hyperextension position and PIP or DIP joint will be flexion position. Now symptoms. First is muscle wasting of the introsus and hypothenar. Hypothenar is the prominent part of the palm of the hand above the base of the little finger. Numbness along the nerve involved and inability to extend the interphalangeal joint during the extension of fingers to the abduct and adduct the fingers. And unopposed action of the extensor and the flexor digitorum profundus and the lumbricals muscle of the ring finger and the little finger are paralyzed. Now diagnosis. First is the EMG, electromyography, to check the muscles and the nerve function. And second is the nerve conduction study to check the electrical sign move through a nerve. Now differential diagnosis or the DD. First is the cervical radiculopathy. The cervical radiculopathy is the irritated nerve in the neck causing the pain, numbness and the weakness radiating into the chest or the arm region. And second is the Dupuytren contracture. Dupuytren contracture is mainly affecting the ring and the little finger. And Klumpke paralysis. Klumpke paralysis is a atrophic paralysis of the forearm and the hand due to the injury of the 8th cervical and the 1st thoracic nerve. Now last is the lower brachial plexopathy. Is a form of peripheral neuropathy. It occurs when there is damage to the brachial plexus. Now treatment part, claw hand. Most commonly use the splint, that is knuckle bender splint, surgery, tendon transfer. Now physiotherapy treatment, the tendon transfer, stretching of the ring finger and the little finger and strengthening exercise of the introsi muscles, lumbrical muscle using the stress ball, pillow and the tennis ball are recommended. I hope so understood this topic. Thank you.